This short training video is reintroducing the Was Not Brought Pathway, a child-focused approach to safeguarding children who miss dental appointments. It's important everybody understands and adheres to this pathway.
Missed dental appointments are one of the leading triggers for child protection referrals in dentistry. They can be early warning signs of neglect, that's why every missed appointment must be taken seriously, as it may be a sign that a child is at risk. By recognising and responding appropriately through the Was Not Brought pathway, we all play a vital role in protecting children's health, safety and well-being.
This pathway applies to a child or young person 17 years or under. Instead of saying a child did not attend or FTA'd an appointment, we use Was Not Brought to emphasise it's the responsibility of a parent or carer to ensure they attend. This small shift in language reflects a significant shift in perspective, helping us all better recognise and respond to potential safeguarding concerns. This prompts us to ask, why weren't they brought? What support can we offer? And what could this mean for their safety?
The Was Not Brought pathway has 3 clear stages. It helps you know what to record, when to contact families, and when to escalate concerns. Let's take a closer look. Stage 1 begins when an appointment is missed. Contact has been made and the appointment has been rebooked. You do not need to add the patient's details to your Was Not Brought log as the child's appointment has been rescheduled. However, please update the R4 notes using the Was Not Brought 1 template.
Within Stage 2, there are 2 steps, Step 1 and Step 2. If there's no answer when we attempt to call the parents, we move to Stage 2, Step 1. This means we would send a Was Not Brought to letter to the parents' email or home address, informing them of the missed appointment and asking them to contact us to rebook. Your list of Was Not Broughts should be logged, and there is a log on the OneDrive that you can use, like the one pictured. Add the child's name, stage of Was Not Brought, and the date to check they've rebooked. Tracking your Was Not Broughts is a team effort. However, each practice may have a different system in place, so it's really important you liaise with your practice manager and head nurse on how they manage them.
We would now move on to Step 2. If there's still not contact within those 3 weeks, attempt another follow-up call. If you are still unsuccessful, update your log with another 3-week review date and record as a Was Not Brought Stage 2, Step 2. Ensure you are updating your clinical notes to reflect this as well. Please also ensure you send a Was Not Brought to letter to the child's home address. All letter templates can be found on the OneDrive.
Stage 3 requires a full review by a clinician who will need to consider many factors before escalating. For example, the child's appointment history. Are they attending for multiple emergencies and not exams? Are there any siblings that present similar? Have you tried all means to contact the family? Email, letter, telephone? Does the child have uncompleted treatment, multiple caries, or only attends with toothache? Do you have genuine concern for the child's welfare? If appropriate, share information with the child's GP or health visitor, ensuring you document everything clearly. If the child is already under a protection plan or is a looked after child, they will have a social worker, so we should consider reaching out to them first.
A copy of the Was Not Brought flowchart is laminated and displayed in every surgery. There is also a copy on the OneDrive in the Was Not Brought folder. It's important to keep GP, school and social worker details up to date and checking these at every opportunity. Use the yellow note and the medical marker on R4 to keep this information. This ensures all team members can access crucial information quickly. Any communication attempts need to be documented in the child's R4 notes clearly.
John G. Plummer and Associates are designated to accept any looked after children or children in care for dental access appointments. A looked after child is defined as a child who has been in the care of their local authority for more than 24 hours. This can include children in various care settings such as foster care, children's homes, and also includes unaccompanied asylum seeker children or those waiting for adoption. Looked after children enter care due to circumstances like neglect, abuse, or other challenging family situations, and often require specialised support and intervention. There are a number of challenges we come across with regards to looked after children accessing dental care. All of these factors should be taken into account when introducing a child to a new environment or a dental procedure.
Looked after children may move placements frequently, and children in need or those on a child protection plan may be more likely not to be brought to their dental appointments. It's important to understand who the child has attended their appointment with and to clarify who has parental responsibility. Every looked after child will be assigned a named social worker, and it's essential to obtain and record their contact information. For any inquiries regarding consent, missed appointments, or to voice any concerns, you should reach out to the social worker. Make sure to ask for the child's GP practice, school, and social worker details if applicable.
When discussing a was not brought with a parent or carer of a child, please remember to be kind and show empathy. There are many considerations or factors which may cause a was not brought, so please take them all into account. For example, parents may be caregivers for a family member, or there may be other difficult circumstances that have caused a child not to be brought in. Remember, the Was Not Brought Pathway is an additional safeguard. It does not replace our responsibility to report suspected abuse or neglect. You do not need to contact the safeguarding team unless you have a safeguarding concern. A Was Not Brought alone is not enough for a record of concern. If you have any questions regarding the Was Not Brought Pathway, please contact one of the Happy Smiles team. Thanks for watching.